Good morning and welcome everyone. My name is Despina Contos and I'd love to welcome you to today's event. It's been something we've been planning for quite some time through ups and downs, as you all know, but we're excited that we made it to the finish line and we're excited that you're all here today. And we will start this day by a short video that we hope captures the essence of CIMBID. Imaging is one of the most unutilized data sources that we have in a medical center.
There are volumes of data that get created in the images we collect from our patients. Now, even the best radiologists in the world can only extract a certain amount of that information.
What is there that I'm not seeing? We have almost an obligation to develop tools to harness that information.
Everybody gets a scan, and the information that is in these scans that already collected, acquired, and stored is immense. CIMBID is a scientific ecosystem that brings together scientists that have this more fundamental computational background in artificial intelligence, data science, and imaging that we can interface with scientists in other domains as well to create this integrated diagnostics research environment.
We now understand this incredible amount about each patient. We have the ability to collect data all the way from the molecular level to the environment. And artificial intelligence is a tool that is going to enable us to understand better what we can offer each patient, to actually tailor it in new ways.
Your genomic data, your pathological data, your exposome data, your current tests, everything is available and works together.
Can we use some of this information to predict which patients are more likely to get a disease, to detect it earlier, to decide what treatment is better for which patient, and to understand better how patients are responding to different therapies?
What we want to do is to measure the brain volume inside the skull. My research focus has been mostly on hemorrhagic stroke, the patients who have a bleeding in their brain. The goal is to identify the patients who are at risk of worsening brain injury after initial brain bleed, and also teasing out what kind of a brain injury would happen. Once we have these AI tools, they can look at the head CT and give us information about where this patient is going to go in the next few hours to have a more tailored treatment toward the mechanism of the brain injury. There is a lot of effort done in terms of creating models or finding new ways of imaging the patients, but very few of them have been translated to the patient practice.
There's a gulf between that research application of research and getting it into practice guidelines.
It's one thing to think about data sets and devise technologies that are going to work on data sets. It's quite another to take that technology and take it all the way down to a patient.
One of the reasons that I chose to live on the medical side of the spectrum is because I would ultimately like to see some of the tools that we make in a laboratory setting make it to the clinic. A more scientifically kind of established path for doing that, but at the same time, a more streamlined way of doing it. We have an algorithm that can tell you if you're coming today for a screening mammogram, if you need to be getting breast MRI or not. Across the street on Broadway, they don't have it. And all women are getting the same screening paradigm without this information. I don't think it gets more real than that. How our tools go from the lab to comparative effectiveness evaluation.
Team science is the only way to solve problems in the modern era. And so the goal is to bring in a collection of experts who know their core area fundamentally and also have respect for and empathy for other perspectives.
Our vision really is to bring the best talent to the most important questions. So CIMBID is designed to do exactly that, to take the best from each of these areas, to understand how imaging can drive artificial intelligence.
This kind of center allows us to be really physically and mentally present to be able to exchange ideas.
The goals are very big. We want to change individual treatment in a way that is translatable and affects whole populations.
The tools are there. The success is already there. The talent is unbelievable under Dr. Contis's leadership, and the talent's growing.
The motivation behind everything that will happen in CIMBID is to bring these new tools, these new innovations into the hands of clinicians who can deliver better outcomes for our patients.
Unless we all come together, there's no other way that we can put together the pieces of the puzzle that every disease represents. Thank you so much. And with that, I would like to invite Dean McKiernan to make some opening remarks.
Thank you so much, Despina. That is a tough video to follow, I'll tell you. Maybe we should have done that at the end. It pretty much says it all. Well, first of all, I just want to thank everybody for coming out today and being here. My name is Jim McKiernan. I'm the interim dean of the Vagelos College of Physicians and Surgeons, if I haven't met you before. And on behalf of myself, the dean's office, Dr. Armstrong, and all the leadership here, I just want to thank Despina for her leadership and for everyone in the room for putting their efforts behind this center. It's an amazing work that's been in progress now for quite some time. And the acronym, I think, says it all: the Center for Innovation in Imaging, Biomarkers, and Integrated Diagnostics, CIMBID, combining the strengths of the Department of Radiology, the Department of Bioinformatics, the Data Science Institute, the Engineering School, all of our molecular aspects of pathology, the Cancer Center, all under one roof. And, you know, I think we've gotten together a lot in the past 2 or 3 months and talked about a lot of challenges and a lot of stress that's been applied to our system. First of all, it's great to have a day that's celebratory and an initiation of a new phase of things, but I want to maybe just for a second try to link those things together a little bit. In every room that I've been in for the past 3 or 4 months, trying to reimagine how Columbia not just perseveres and survives during a relatively stressful financial environment, but also comes out as a leader and thrives on the other side of this, has led to sort of multiple kind of general rules or recommendations, and I'm just going to state those for you. We need to focus some of our limited resources on things that we're excellent at. We need to combine resources across not just the medical center, but across the whole university and harness the strengths of things that are uniquely Columbia that nobody else can do. And we need to focus on areas that are big problems with solutions that are forward-looking, harnessing technologies that are going to be around for a really long time. Does that sound like a roadmap for CIMBID to you? So that's a parallel conversation. Like, how exactly are we going to be successful in the next 5 years? Very practical question. Let's put together programs that meet those criteria so we can enter into the scientific competitive landscape with an advantage. And every institution is trying to do something harnessing AI in healthcare. Every institution is trying to predict things based on big data and bioinformatics. But housing it all in one center, channeling all of our efforts into that center, and being able to come out on the other side with a product and a mechanism that attracts new talent and makes us the most competitive center, not just in the East Coast, but in the country or the world. That's the mission that I see for this organization, and I think this is exactly where we should be focusing our types of resources in this kind of constrained environment, I'll call it. So this is not something that we're worried about. This is exactly what we want to place our bets on, and this is exactly the kind of enterprise that's going to make us great and going to make us able to survive and also thrive on the other side of this challenging moment that we're in. And I can say that our hope and faith is in this group and everyone in this room and everyone that joins this room in the future, that these are the problems we want to solve, this is the technology that we have to be using, and this is the talent that we're going to do it with. So I want to thank everybody for their efforts, and really excited to watch this center launch, watch it get rolling, and start to refer all kinds of resources and also talent in the future into it. Congratulations, Despina. Thank you.
Thank you so much for your kind words, and I want to say that the challenges that we've been facing lately made us even more determined, not just to plan this whole event, which took a lot of effort, but also to really try to think about and capture the essence of what this center is all about. So thank you for for your support, especially during this challenging time. And with that, I'd like to welcome our department chair, Dr. Ajay Gupta, to give some opening remarks as well.
Well, thank you all for joining us today. Thanks, Jim, for your remarks and reminding us why what we're doing is so important and how it's more critical than ever for us to continue on efforts like CIMBID. And I think after the last couple of months where when we think about science, we've had to navigate things like freezes, pauses, terminations. It's so exciting to think about a new start, a fresh beginning, a new initiative. So Despina, I wanted to really thank you for your leadership. I know you've been here at Columbia for a little bit longer than a year. Despina is not only a preeminent scientist in the field of applying artificial imaging to medical imaging, but she's also really extremely collaborative, a lot of energy, a lot of passion, and I think she's the reason that we're all here together and have that blueprint ahead of us. I'll say as the chair of radiology, I think a lot about how this research initiative fits into what we more broadly do for our patients. And I'll say I don't think there's ever been a time in the history of medical imaging that's more exciting than the time we're in now. So if you think about imaging, we're really privileged to be able to care for all patients across the spectrum, including patients before they're born in utero all the way to the end of life. And in those encounters, we take care of patients and generate data. And that data comes from images that we generate from head to toe. And believe it or not, close to 90% of the data that's generated in health systems like ours are imaging data, pixel-based data. The flip side of it is that about 10% of that data, even in the hands of the most expert observers in the world, and that's our radiologists here at Columbia, only about 10% of that data can be extracted into meaningful information to drive patient care. So imaging generates 90% of the data in a health system, but we're only able to extract 10% of that data for the care of our patients. That's a gold mine of data. And in that data lie signals and patterns that allow us not only to diagnose diseases more precisely, but hopefully intervene at a time in a patient's trajectory before the disease manifests itself. And in doing so, hopefully allow us to prevent disease in the first place and to really bend the trajectory of so many of the devastating diseases that we're trying to address. All of us are trying to address at a place like Columbia at this medical center. And I think that's really the promise of CIMBID, to frame it in terms of what Dr. McKiernan said, in terms of being as efficient and smart with our resources as we can. The data exists here. We have to bring together the expertise in medical imaging and computer science and data science and engineering, not only the expertise here at VPNS, but across CUIMC with our partners in industry, with our tripartite health system, with New York Presbyterian and our partners at Weill Cornell, to come together under one roof to really advance the application of artificial intelligence in medical imaging. So we're really, really excited. Despina, congratulations. I know this has been a lot of effort to get us here to what is really the starting line for what I hope and I know will be an extremely impactful center that will advance how we care for patients and how medical imaging delivers the cutting edge to all the patients, not only here in New York City, but throughout the world. So thank you for your efforts. Thank you for your leadership. Super excited, and thank you all for joining us today.
Thank you so much, Ajay, for your kind words. And as you will all see today, this is absolutely a team effort, and it absolutely takes more than a village to make this happen, which is why we came to New York, because it's a big, big village, right? And so with that, I would like to welcome my wonderful colleague and friend, Dr. Noemi El-Haddad, chair of the Department of Biomedical Informatics, and also the leader of the AI initiative at the Vagelos College of Physicians and Surgeons, to give some opening remarks on her vision. Thank you, Noemi.
Hi, everyone. I'm very excited to be here. Despina has become my best friend over the past year. It's been a joy to work with her. So I have a few slides. I wanted to give you a bit of an overview of what's happening in AI at the medical school. And you'll see through every slide how CIMBID plays a role in our mission and our vision. And I'm going to figure out how to go through the slides in a second. Okay, here we are. So we like to think about, what is our goal? And I'm reusing a framework that many of you might already know, which is our quintuple aim of healthcare, better outcomes, obviously, but also clinicians' well-being, health equity for our populations, improved patient experience, a one-on-one experience of patient with the healthcare system, and new biomedical knowledge. And already in here, you can see some of what you've seen in the video for CIMBID, how imaging and biomarker integration will play a role through diagnostics, but in all of the ways that it percolates through all of these ideas. And it translates itself when it comes to AI in many ways and across this spectrum. So in discovery, we are aiming with AI to uncover the heterogeneity of disease, redefine diseases really, and uncover new phenotypes potentially. And that helps us also understand new mechanisms of disease, and it helps us discover new treatments. It's also changing the way we translate biomedical knowledge into care by integrating these biomarkers, by predicting individual patient trajectories, and by matching the right therapy to the right patient. And finally, in care, AI is changing already, and I'm sure you've seen it even in the news, the way AI can support clinicians in their information need, making sure that they don't get burdened by the needs of healthcare. It helps clinicians, and maybe here it's maybe more of a potential right now, but one that is kind of already happening at Columbia. It helps clinicians in making decisions and personalizing those decisions to the specific patient that are under their care. And finally, maybe a little bit less in the news, but very present at Columbia University, we use AI to empower patients, and we believe that AI has a really a moral incentive and to empower patients. All of these ideas of AI, if you think about them, they're building on building blocks that exist here at Columbia and VPNS, and that CIMBID is contributing to, and the Department of Radiology already had started. Knowledge, medical knowledge, data, Ajay, Jim, and Despina already mentioned the invaluable data sources that we have here across the spectrum. Algorithms and computational power, we work very closely with our colleagues in engineering and at Melman. And finally, this human aspect of AI, which might sound like a funny thing to say, but one that is very present and we have to think about for the future. It's not about building machines, it's about helping humans, and it's about supporting humans in their needs. And so we're moving towards a future of AI where it's not just a machine giving one output, but rather than an interaction and a dialogue between machine and humans. So we want to rethink medicine with AI. We want to think about the clinical patient-generated exposome, imaging data, obviously, like the work at CIMBID, and they're no longer static, and they all relate to each other. They're temporal, they're multimodal, they encode evolving practices. Biomarkers are not just a number, they mean something for the patients behind them. And then we think of AI as the tool that connects the dot, that helps the clinician connect the dot, helps the scientist find the new discovery. And finally, AI does not behave in a vacuum, but it interacts with humans. So thinking about the role that AI can do and how much it can have an impact across all of our activities in a medical school, we kind of decided to take a step back, and rather than to encourage AI happening in silos at VPNS, to come up with a broad initiative on AI. And so this is our vision. VPNS harnesses the power of AI to accelerate breakthroughs in biomedical sciences, empower healthcare teams, and improve the health of all. And our mission is to spearhead innovative, safe, and robust AI through collaborative research, bidirectional community engagement, transformative education, and patient-centered and clinician-supportive approaches. And we created different working groups, and right now we have nearly 100 affiliate members to the initiative that are helping us really deliver this vision. So we are doing work in AI governance and oversight at Columbia, but also outside, community health, research, operations of our medical school, training and education. What does it mean to be a clinician in the age of AI? And clinical care. We're very lucky at Columbia because we have a lot of crowns on our slides. That's not the reason why we're lucky, but there's a lot of slides. There's a lot of crowns on this slide. But we're very lucky because we have fantastic stakeholders that we collaborate with and we can build with. And CIMBID is already talking to all of these stakeholders and AI at VPNS as well. I just wanted to give you very quickly an overview of what we're doing in each of these domains. So in oversight and governance, as I mentioned, we are working on internally instrumental support. How do we deliver AI tools and generative AI tools to our researchers and clinicians? We created a governance that is aligned with our tripartite Cornell and NYP partners. But we're also thinking about what does it mean for AI in medicine and in healthcare to be ethical and to follow principles of justice. And so we're working very closely with people in bioethics on this. Community health, our goal is to ensure that AI is a catalyst for better patient outcomes and that it empowers not only individuals but the community. Linking AI to health disparities might sound interesting because you might hear a lot about AI as a bias maker maybe and an enforcer of existing bias, but we really believe here at Columbia that it can be the opposite, in fact. Training and education, our goal is to equip the VPNS community with the skills and knowledge to navigate, to innovate, and to lead in a field that is moving very, very fastly. And so we're working across the spectrum of education and training. And I know CIMBID is very research-oriented, but they're already taking part in some of these activities, thinking about how to train our graduate program, our graduate students, and thinking about the residents who will become radiologists and will need to use AI. I want to mention that we do a lot of training and education in the initiative and just some advertising for a summer school that is open to everyone, industry and academia, in July, in about a month. And that one is about using data from real-world evidence and with AI. Clinical care, I thought it was funny that I could only put 2 items here, and it's such an active working group. And I think it's just because we're actually doing this, and there was no better way to describe what we were doing with this very high-level way, which was one is we're building AI to innovate and do innovation in AI to really support our clinicians. Columbia University has a long tradition of building clinical decision support systems that use AI. And I think one very exciting thing about CIMBID is we're now going to be able to integrate with imaging. And that's a very, very exciting and unique thing, this combination of clinical and imaging. Through the initiative, we're building new tools that don't exist yet in vendors and in the industry. We are creating tools that are really aligned with the need of our clinicians, such as Chart Chat, says that 3 times. It's a beta tool that is really a generic open chatbot on top of your patient record. And then we created a lot of governance and processes, working with NYP and Cornell to translate and evaluate this AI research at the point of care. I want to end with research, obviously, a lot to do here. And our goal here is to provide the means for groundbreaking research in fundamental AI for biomedicine and health, as well as in AI-driven research. And we really believe that the two are needed. It's not simply taking the latest AI technology and applying it lavishly to our data types. We need to really rethink a lot of AI. And so we established some priorities, and again, you see CIMBID fitting very well into here. Fundamental research on AI, federated learning, how do we make sure that people can collaborate and sites can collaborate with each other when they cannot share data with each other, foundation models, mechanisms of interactions between humans and AI so that humans stay in control of our AI mechanisms. And then AI-driven research, early detection, diagnosis, and prediction, as well as new treatments. And finally, we are building core services for things that can be built already, like federated learning. So I'll stop here and congratulate Despina and the entire team again. We're very excited. Despina has already been a majorly active member of the AI initiative, and it's been a joy, and we're looking forward to many more years of work. Thank you.
Thank you, Noemi, for your kind words, for your support, and for becoming such a wonderful friend and partner in the short time that I've been here, but a very long time I look forward to being here. And so I will go over now a little bit in the next 15, 20 minutes or so with what we see as an overview of CIMBID, its programs, its structure, how you can become engaged, and so forth. All right. So why are we so excited about imaging? I'm a computer scientist by training. I have no medical training. I'm not a radiologist. Why is there such an excitement, at least from me and people like us, to be in this ecosystem within a medical school, and especially in the Department of Radiology? One of the many reasons is the hidden potential in the radiology scans, the vast amounts of data that we collect daily, and I would like to say about 80% of this data is unutilized. So as Noemi just talked about, in a medical center especially, we have various sources of data, electronic health record data. You may be very familiar with research around that area, blood tests, pathology, genetics, genomics, and so forth. But radiology, as I said, in my view, is one of the biggest and most untapped sources of data in a medical center. Just in our department, we do about 1 million scans a year. And all these scans are stored. Nothing is wasted. If you go back, you can go back to 10, 15 years, all this data is available in infamous database that every radiology department in the world has called the PACS system. And usually to get access to this data, you kind of have to know people who know people. Right? It's not the easiest database you can get access. We have the track requests here at Columbia, and a lot of people complain, it takes time, whatever. But let me tell you, it's a very good system. It can be way worse. And the imaging data are completely out of the equation. So if you want to do research with imaging data, how can you get access to this data? We'll talk a lot about this today, and we'll also launch a platform that anybody at Columbia University who wants to do research with imaging data doesn't have to know people who know people. You can just go on a website and put a request, and you'll get your data. So this has been kind of like my own life drama. I've been traumatized by this as an investigator, and I kind of wanted to make sure that nobody else has to suffer this way ever again. And so what else is exciting about imaging data? We have a lot of wonderful radiologists here today, and I will tell you that no artificial intelligence does better than intelligence. You can see papers, sometimes it compares equally, but when you get really well-trained radiologists, there's nothing that can beat them. We're interested not in just looking at the scans to tell you if there's something there, to diagnose a cancer or to find the disease. We're very interested to tell you what will happen in the future, and to take information from imaging data that's not routinely assessed, quantified, captured, it can be very variable, and put that into numbers, put that into a context that you can make decisions, a clinician can make decisions, and patient can make decisions in a way that they're more informed and enable personalized medicine. Now, you'll see a lot of paradigms along these lines in the presentations that will follow, but keep in mind that we're looking to get information that we don't routinely utilize. And this is a win-win for everybody, because this data, most of what we'll talk about, is with data that are routinely clinically collected. So from a cost efficiency perspective, this data is already paid for, reimbursed by your insurance. You're not paying extra money to get that information. You may be using some software, but in this day and age, that software applications, especially of this kind, is probably the cheapest assay you can have in a clinical environment when you compare to some of the more, expensive assays that we see emerging across domains. So this is information that is very useful, as you can see, that's sitting right there in that PACS database that nobody is using, and with a very cost-efficient, quick manner, we can make clinically available. The other really exciting thing is that when we talk about the translation of AI in the clinic, about 80% of the tools that have FDA approval to be used clinically involved some kind of imaging, and most of them involve radiology. Why is that? Were we some kind of like wizards that knew in advance what was going to happen? No, it is because imaging data is so heavy and so complex and so difficult. All you have to do is ask a thoracic radiologist about finding lung nodules in CT scans, and they will tell you that at any point they will happily give up this task to a computer. So radiologists figured out way early in the game that they need the help of computers to make sense of this data and, more than anything else, make their life easier. So from a translational perspective and the mission of our center, this is also a very mature market. The tools that we make here in a laboratory setting, there are infrastructures in place, both as we will talk about at Columbia University, but more broadly, that can actually take these tools and do something useful. And this is something really exciting and interesting, especially for someone like me who comes with an engineering computer science background. One of the main motivations for us to be in a medical center in a department of radiology, that we would like these tools to do something more than being a nice publication that get us promoted, to actually help some of the physicians in the room to do something useful for the patients. And we're gonna go into more detail a little bit about that. So what is CIMBID? So CIMBID is an interdisciplinary center with a home in the radiology department and the VPNS, the Vassar School of Physicians and Scientists, centered around the Department of Radiology, with strategic partners, as you will see, in engineering, in the Smailman School of Public Health, at the Cancer Center, the Data Science Institute, the Zuckerman Institute, the New York Presbyterian. We'll go over that in more detail in subsequent presentations. We have leadership to solidify this relationship. Great colleagues and friend, Dr. Lisa Conofago from the School of Engineering, Dr. Jeff Goldsmith from the Mailman School of Public Health. You'll hear more from them shortly. So that the activities of the center, even though we're a school a center in the medical center, span the entire university with strong partnerships and relationships in other schools. The goal of CIMBID is as you will see, is threefold. We do come out of a strong motivation for research, as Noemi talked about, dedicated to developing and integrating quantitative imaging and non-imaging biomarkers for disease prediction and treatment. So leveraging data science and AI to develop next-generation multimodal tools and applications and predictive analytics, create a multidisciplinary ecosystem for scientific innovation, and develop the infrastructure and partnerships for the clinical transition of the AI tools. And this is an area that infrastructure, in my view, and data are as equally important as the science. There's a reason I say sometimes when we call it data science, because the data is as important as the science, and without the data, you can't do the science. So, CIMBID's mission spans three main pillars that are all equally important: research, education, and translation. In the research domain, we hope to be a cross-campus ecosystem of multidisciplinary research innovation and collaboration, from basic methodology development, hypothesis-driven investigations, and disease-focused applications. And you'll hear more about from CIMBID investigators shortly. In the education domain, if you are a basic scientist who lives in a clinical department, you know in the lifespan of your career that there are a lot of times when it comes to education, you fall through the cracks. Unless you're super active about it, you have zero exposure to students. You don't have undergrads, you don't have grad students, because you have no graduate program. Postdocs kind of find you on their own. You have residents and fellow, but most of the times they're tied in the clinic, so you really have no direct exposure to trainees. And that's a huge, huge issue and a big loss in my view. So when we want to educate around these technologies, it's very important to us to be very integrally involved with the training mission of the institution. So you will hear about how do we plan to build those bridges with graduate programs at Columbia University and the Medical Center. How do we plan to engage undergrads and trainees across the board? How do we plan to be close to residents and fellows to make sure that we can sort of educate, but we can also be educated from the next generations? We plan to be involved in didactic courses, as I said, graduate programs, research mentoring, but we also, as we get up and running, we're really thinking about also offering some coursework tailoring around the mission of CIMBID in the form of CME courses, certificate programs for professional development, and so forth. And the third pillar, a very strong pillar for us, is the pillar of translation. As you will see, we have a very strong, active partnership with NYP, both in terms of leadership and resources that have been put into the center to create the pipelines that will take the tools from a laboratory setting and put it at the workstation of a clinician. And we also aim to build very strong partnerships with industry. I would like to say reinvent partnerships with industry. I think this is an area that in academia we can do so much better. And especially when it comes to AI, it's the only way forward, to partner creatively with industry to catalyze pathways for commercialization and translation. So you'll hear the program for today's event is structured along these three themes. First thing in the morning, you're going to hear about the research for CIMBID. Then we're going to go into the educational initiatives. And then we're going to have the clinical and translational session where we're going to hear about some of these initiatives and also have a panel discussion around what are the challenges and opportunities in the translation of these tools. And last but not least, we will have a demo launching this platform that if you want to do research with imaging data, you don't have to know people who know people, and that's really important in my view. I will highlight a few of our programs and services. We're very proud to say that our website is also launching today, and we will make sure to keep updating with information over the summer, especially with all the services and programs that we will be offering. So first and foremost, large-scale access to curated multimodal imaging data for anybody in the Columbia community. And we hope to make that even broader with the partnership of NYP and Cornell to make it a platform for the tripartite partnership. Anybody who wants to access imaging data can come to us and we can help you identify your cohort, pull the data out, and give it to you in a very nice anonymized form. And we're also very proud to say IRB approved form. This platform already has the infamous IRSAM number, so when you write your IRB, you can put it in and everybody will be happy and your IRB will get approved very quickly. Imagine that. We're also going to be offering study design guidance and consultation on imaging research across campuses. One of the things that happened to me as soon as I landed here is how many people are getting in touch because they want to do something with imaging and they don't know much about how to do it. Oh, I want to do a study. I'm not a radiologist. I'm not a computer scientist. I'm a surgeon. I'm an oncologist. And I want to have an imaging endpoint, but I have no idea how to go about it. So you can come to us and we can help guide you how to go about it, how to design your study, what's the appropriate endpoint, and get you the data that you need. Either pull data retrospectively if you're looking at historical data, or provide a platform for you if you're doing a prospective study, a clinical trial, to store your data safely, index it, organize it, link it to other data through REDCap, and all these beautiful things that you'd like to do as a researcher. So that's second point. Third point, we hope to soon be able to launch a seed grant program in partnership with the DSI and the Cancer Center and so forth to accelerate research innovation and try to partner scientists with a computational background with clinicians to help spearhead new ideas and try to generate preliminary data that will get future projects underway and translation. This also came through my other experience of how many physicians have come emailing me saying, I have this great idea, if only I could have that, and me thinking, if only I could push a button and make it happen, right? But there's so many great ideas that are brewing from clinical experience and would like to catalyze these opportunities and make it possible to get things happening for investigators. We're very proud and excited to also be partnering very closely with the Data Science Institute. We will be launching a partnership that will formally start in the fall, informally over the summer is piloting. We call it the SIP, the Student Innovation Partnership, where we'll be looking at engaging undergrads and master's level students who want to do some kind of project with CIMBID, the DSI, and investigator. Very exciting. We will also splitting the bill between CIMBID, DSI, and the investigator to make it feasible, especially during these times. This also came from the idea from so many physicians coming to us and say, I have this great idea. I wish I could measure this in the clinic. I wish I could do that during surgery. And how do we do it? And especially in situations where there's not an infrastructure in place, a lab in place, a grant in place, and even now that's even harder. So I think this is going to be a win-win, bringing students into projects, students that are well qualified with a computational background, and with the support of the institution, get some of the ideas up and running. We're working very closely with the Columbia Tech Ventures to potentially initiate an AI software accelerator or join an existing one, giving a pathway for commercializations for a lot of the ideas that are going to be launching here. And also, I think it's very important, a pathway for our trainees to be part of commercialization while at Columbia University. You know, I used to say when I started as a faculty member, every student in my lab wanted to be a professor. Those days are gone. Almost all the students in my lab want to go to industry, and most of them, they want to go to a startup. So I keep saying to them, why do you want to go elsewhere to do your startup? Why don't you start it here, right? So these programs could help educate our trainees to do this type of work while they're here and continue their work with Columbia. And we also hope to be launching an industry partner circle with kind of creative ways to partner with industry. We want to hear from industry. We want to hear what is interesting for them as well, what is interesting for us, and come together in a creative way to catalyze industry-academia partnerships. One of the very, very excited partnerships, and you will hear more about it today, is our partnership with the Biobank. One of the first things when we came here and we started thinking about CIMBID is to initiate this partnership with the Columbia Biobank, where we aim, we're not there yet, and it might take us a while to get there, but we aim to enroll every radiology encounter in the Biobank. Remember, we do 1 million scans. Even if we do 10%, even if we do 5%, that would still be an unprecedented imaging genomics database 5 years down the road and 10 years down the road. And this is something we want the Columbia community to benefit from. So you'll hear more about this effort, where we are right now, and we're excited to continue accruing. As I mentioned, you know, the partnership with NYP is one of a kind. We're excited to be in close coordination with NYP leadership. You'll hear from Beth Birchall later today, and we're very grateful for the support of NYP and all the resources that have been put into the center to help catalyze translation. In terms of our leadership, I already mentioned, you know, so grateful for the partnership and friendship of Elisa and Jeff. You'll hear from them today. And this is truly a team effort that you will see unfolding through all the discussions we'll be having today. Our thematic leaders, the structure of CIMBID is such that it's sort of like we have a scientific steering committee that is comprised from the CIMBID leadership and thematic leaders, where we sort of meet every month and plan the day-to-day activities and the general direction of CIMBID. Dr. Ruth Carlos, the Director of Research and Outcomes and Care Delivery, Dr. Sachin Jambawalikar, Director of Research Informatics. I can't even tell you the amount of work that Sachin has put in to get Flywheel off the ground and this platform that will give everybody data. I want everybody to think about that when you access that data. Dr. Sam Hayavash, one of the newest recruiters from CIMBID, Director of Clinical Translation and Innovation, will be working very closely to streamline all these pipelines for commercialization, IP, and so forth within CIMBID. And Dr. Junhao Wen, you'll hear from him shortly, one of the first recruiters of CIMBID as well, Director of Imaging Genomic Research. CIMBID membership structure. First and foremost, CIMBID membership is free and open to all faculty who find themselves aligning fully or partially with CIMBID missions. There's no barriers or a secret club in becoming a member of CIMBID. The more the merrier, and we welcome you all to reach out, ask questions, and become members. The website has information on how to contact us to become a member. We've already reached out to some of you that we thought would like to be part of the inaugural membership, but we would like to see this membership grow. And we consider as primary members faculty whose research fully aligns with CIMBID's. These are mainly data scientists and shape the core leadership of CIMBID and Scientific Steering Committee, and affiliate members, faculty whose research may be fully or partially aligns with CIMBID, faculty across campus, physician scientists, imaging instrumentation, engineering, everybody's welcome. And the membership give access to CIMBID resources, seminars, seed grant programs, infrastructure, and so forth. We're in the process also of forming an external advisory board. We welcome your suggestions. If you're interested in being part of it, please let me know. And we would like to launch this in the fall to get input from externally on how to steer the direction of CIMBID moving forward, especially during this sort of a little bit roller coastery times. Very quick overview. So you'll see in the presentations that are coming out a little bit of CIMBID's research for multimodal methodologies that address fundamental methodologies for analyzing the imaging data, segmentation, feature extraction, model building, training AI models, and so forth. You'll hear more about it later today. In neuroscience and neuroimaging, from using AI to combine genetics with imaging to understand the process of aging and diseases of the brain. Dr. Wen will talk more about this shortly. Neuroimaging, the risks of stroke, acute intracerebral hemorrhage, approaches that we can use scans and AI to identify individuals that are higher risk versus low risk, how that implicates their management in the clinic. In cancer, we also have a big, broad portfolio in cancer and strong partnership with a cancer center. How do we use, for example, artificial intelligence to identify which women may be at high risk of developing breast cancer, and what the implication does that have for the screening? Participation in large consortia, including federated learning approaches. And these are some of the very few highlights of research that we're going to go right into the next session, and you're going to be able to hear much more in depth from our investigators. So thank you again for coming in today. The future of personalized healthcare is here. We hope to be a big part of that puzzle, and we are excited to unfold CIMBID today and look forward to your support, your partnership, collaboration, and thanks again. I think we're right around time. Unless we have any burning questions, we can roll into the talks about the thematic research presentations. But if there's any question, I'm happy to take one or two questions before we go to the next talk. Yes? 1 second, wait for the mic, because we're also recording the sessions, and they will be available later online.
Yeah, you and Dr. Gupta said that 80 to 90% of images cannot be used for your analysis. Is it because those 90% images do not contain the useful information, or we are limited by the capacity to analyze? Well,
All images can be used for our analysis. The reason why the images haven't been used so far is because it has been so difficult to access them in a large scale, right? You would have to literally identify them and download them one by one from that database. And that was okay up to the time that most studies had 100 cases, 500, maybe 1,000. But when we're talking about AI models, we're getting into like 10,000, 50,000, and 100,000. Those days that you could download each scan one at a time are gone. And I think this is why we emphasize the importance of infrastructure. So we can use all the images. There is no restriction. The only barrier so far has been the infrastructure, which we hope to catalyze.